and let us see how we can encourage our people to obey the simple rules of health insurance as enunciated by government through this commission. That is the situation.
Medical laboratory practitioners in health facilities under the Delta State Contributory Health Commission have been warned to stop collecting charges from enrollees of the scheme for laboratory tests. The Director General and Chief Executive Officer of the Delta State Contributory Health Commission, Dr. Isaac Akpoveta, issued the warning during an intensive training program he organized for laboratory scientists drawn from health facilities registered with the Commission across the state. Speaking at the Commission's headquarters in Asaba, the Delta State capital, Dr. Akpoveta pointed out that majority of the laboratory tests required by enrollees were already covered under the state's contributory health scheme, and there was no justification for charging enrollees for tests that had already been paid for by the Commission. He said enrollees were not expected to pay for tests such as ultrasound tests, PCV, full blood counts, urine tests, x-rays, among others, pointing out that some of the tests were covered in the capitation paid by the Commission, while any tests not covered in the capitation carried out on any patient were refunded to the health facility. The DG frowned at the way matrons turn primary healthcare centers into private businesses, extorting monies for drugs from patients instead of requesting for drugs from the Delta State Drug Revolving Fund DRF, and warned them to desist. He reiterated that the Commission would take disciplinary action against practitioners or facilities found violating the scheme's guidelines, emphasizing that such illegal acts placed the burden of out-of-pocket medical expenses on patients, which the Commission was combating. Dr. Akpoveta urged medical professionals to cooperate with the Commission in ensuring the efforts of Governor Sheriff Oborowori in promoting the health of Deltans yielded more fruits.
So it's a national, it's international situation. Of course, we are aware recently that NHIS have sanctioned many hospitals and delisted some hospitals for fraud, including the HMOs, because of fraud. So fraud is very prevalent in health insurance, and that's why we're doing everything we can do. We introduce so many measures: facial encounter system, bundle payment, pre-capitation with monitoring. We put outside there SQM, service quality monitors. We call them agents who monitor the prescriptions dispensed to the patients. So the extent that now the pharmacists will dispense half of the drug prescribed by the doctor. Instead of 30 days refill for hypertension, they will fill drugs only for 15 days, even for 10 days. You can't imagine it. And when you ask them, is IGR dry? Yeah, it was some since last year. It says, Her Excellency, the wife of governor, is a mother of the state, the first mother. And he was worried about mother-child transmission of hepatitis. And we had a discussion that we need to see that we can discuss this early enough, take precautions and preventive measures to reduce transmission to the child. And so we adopted it, and then we put it our team. And so for more than a year, Delta is the only state in the federation where hepatitis is compulsorily tested in all pregnant women, courtesy of Her Excellency interest. We are advising that every big hospital to have a health insurance unit dedicated to health insurance enrollees. So when you arrive in the hospital, you don't need to go and join that general crowd. You go to the health insurance unit where a doctor is dedicated to the scheme, a nurse, a pharmacist, a laboratory scientist, a ICT person, all of them in a small unit. Quickly attend to the patients, prescribe for them, give them their drugs, and let them go. We cannot put health insurance and release in the crowd of people that will be attended to in 3-4 hours after waiting for. It's like what happened in the bank those days. The bank those days, you go to bank, a long queue to collect money. Until the bank came out with POS, with the ATM, with even transferring your phone. So there's no more queues in the banks anymore. So we want to create a situation where we can do that kind of micromanaging of our release to reduce them from the suffering of long queue and waiting. So we are introducing health insurance unit in all the hospitals.
Participants described the training as insightful and engaging and promised to play their roles in ensuring residents of the state enjoyed unhindered access to affordable and quality healthcare services provided by the state government.
One important thing I learned is that for the antenatal patients that comes to register, they're not supposed to pay any money for the test, even on registration, because at the end of every trimester, there's a bundle payment for them, which covers both the laboratory tests and every other thing that we done for them. That's one of the things I learned. And then there are other tests too that are covered in bundle payments for enrolled patients that we have. There are some of the tests I didn't know that was covered. So such tests, usually the patients pay for them. And there's an enlightenment that those tests are covered, they're not supposed to pay. The scheme has good intentions, and we hope that we follow through with good intentions so that Delta and Swiss
We were taught on the better state contributing health scheme, the billing, how to attend to patients, especially the pregnant ones, and that Delta state government paid majority of the bills, that hospitals should not collect money from patients. Although the information was scanty, but at least by today we were educated to know more about what is going on. From the information I gathered, I think I will put it into use what we are taught here.
Dr. Isaac Apoveta had trained the participants on topics ranging from billing protocols, ethical medical practices, and the role of healthcare workers in the success of the contributory health program. Eunice Emeyazia reporting.